are for our second video. We're now talking about a large body area like the quadriceps or the hamstrings on the back of the thigh or the gastrocnemius on the calf. A lot of these techniques are additional techniques that you could do on the low back or big areas like this. So you can do many of the same techniques that you've already learned, the different effleurage, petrissage, percussion, deep friction, all those kind of things. The strokes we're going to start off with to show you that are new are various sweeps. Okay, so I'm just going to spread a little lubricant. Since we're doing the quadriceps, we have our patient on his back with a pillow under his knee and appropriate draping. Okay, so effleurage to just cover the area. If you're doing one of the sweeps, you don't need a lot of lubricant because you don't want to be sliding over the surface. You want to be going slowly. So the big thing about sweeps is you're going to choose the appropriate sweep for the size of tissue you're going over. The larger body surface for the larger areas, the smaller surface area for the smaller parts. So the first one we're going to do is the forearm sweep, and you're actually going to be using this bony side, pinky side of your forearm to go along the area. And generally you want to go from distal to proximal very, very slowly. So for this one, it gives you a real mechanical advantage because you just put your weight in and then you just shift your weight from one foot to the other and go very slowly to mechanically help these muscles to let go. You don't have to do a lot of force to have a lot of effect, but that's a forearm sweep. Too much pressure? Okay. Very, very slowly for all of these and lightening up as I get to the top. Another one that's for a medium size area, or you could do multiple sweeps, is using the heel of your hand, and this one is called ironing. So you just do the heel of your hand, you can superimpose the other one on top. They should be deep pressure, but not painful. You also don't want to be pulling hair, so you want enough lubricant that you're not doing that. Pressure okay? A little hard, so I'm going to lighten it a little bit. And I don't have to exert a lot of pressure to get a good effect, but very, very slow as you're mechanically trying to get the fibers to realign or to release. And I would go all the way up very slowly. Okay? If you get a smaller area, I don't know that I would use it here on the quads, but maybe here on the shin for shin splints, or on the arm you can do it. The next one is called the thumb index sweep, or people jokingly call it the Clinton because of President Clinton using this. You're putting your thumb against your middle knuckle here, and then you're using the flat part of that knuckle to do your sweep. For these smaller ones, you want to make sure that you anchor and then sweep. I'll come a little bit over so you can see a little bit better. It's a more localized point and you're pushing away from you. So you want to make sure again that you're doing good pressure but not too uncomfortable, and you can move your anchor point up as you go. Thumb, index, sweep. And I can do multiple sweeps, but you want to go slow enough that just a couple of sweeps is effective for what you're trying to do. That's the thumb index sweep. Again, I'm not going the whole way up on these just for time's sake. The last one is a knuckle sweep, which we demonstrated in lab that you can go on the upper trapezius or the supraspinatus. But for this one, you're again using the flat part of your knuckles here with the other knuckles straight, so you have force. So you anchor, and then you use that flat part of your knuckles to do the sweep. Too heavy? Moving your anchor as you need to, and whether my palm is facing one direction or the other, it doesn't really matter. Whatever feels more comfortable for you. Just a long, slow sweep. Okay, so we had the forearm sweep, we had ironing with the heel of the hand, we had thumb index sweep, and now knuckling or the knuckle sweep. Deep techniques without the depth of petrissage to mechanically help large areas or smaller areas release. A couple of other techniques that we want to cover as well that are not sweeps. One that feels really good to me, like I said, you can do it on any long, thin muscle or muscle group, is called shingling. This one's in between depth of effleurage and petrissage. So what you're going to do is use this part of your fingers to begin to do pressure up an area. And you go a little way, and then you come underneath it with your other hand. And just like shingles of a roof, you do one hand, then the other hand, each one overlapping and going up as you go. So I'm going to go in one area, one stroke first, and then I can repeat and do another one on a large area like the quads, but that's shingling. Okay, that's shingling. Now the next two techniques are actually myofascial techniques, and they're considered superficial techniques because they're mechanically trying to make the fascia release superficially, but they're the deepest actually of the pressure of the techniques you use. We'll get into that another time. The first one is called J stroking. And in J stroking, you're going to anchor with one hand, and with your index, long, and maybe ring finger, the other one, you're going to pull down and go a couple of inches and then do a little hook. J. J. You should be seeing the skin turning a little white with this, and your knuckles a little white. J stroking. It doesn't really matter whether I hook one direction or the other for a muscle group like this. If I was going along the spinous processes, I'm going to go away from the bones. That's J stroking. And then the last myofascial technique is strumming. And in strumming, you're going to get your fingers like this so that these knuckles are at 90 degrees. Can't have fingernails for this one. You're going to dig into the area where you're wanting to release, get down as deep as you're wanting to go, and then just strum back and forth. Not plucking a guitar string, like going over, back and forth over a spasm, but just back and forth to try to make it mechanically release. That's strumming. Okay? Again, many other techniques you can do in these areas. That's just a few new ones. We're going to break now, reset up, and show you a few more techniques on the arm before we finish. Now for doing potentially an arm massage. This would be for treating something maybe of the forearm or the hand or the elbow. Can't see the shoulder in this frame, but some of the same techniques can be used for that. So let me get a little lubricant on here. Okay, what I'm going to show you now, again, a lot of the same techniques that you've already learned can be used for this body area. I'm not draping his shirt because we're not going up to the shoulder. We're staying here at the elbow, so we're okay as far as the draping. I'm not going to get oil on his shirt or anything there. But let's say that he has tennis elbow. And these muscles here, the extensor muscles of the forearm, are tight. And he also has tendonitis right here where it's attaching on the lateral epicondyle. So we have a couple of problem areas that we can work on. Okay? First we can do thumb kneading on these extensors, just like we've done on the others. We could do picking up, we can do ringing, we can do that thumb index sweep. That's my Jack Russell doggy that you're hearing clitter-clattering down the hall. We could do the knuckle sweep. Of course, I'm going way too fast. But the new one that we haven't done yet is the cross friction massage. We've done the circular friction massage, but the transverse friction are for tendons or ligaments that you're trying to realign into the appropriate direction. So these tendons are coming up onto the lateral epicondyle here, coming this way. So I get on them. I'm not on the bone, I'm just proximal to them. I do deep pressure, too much, and I go back and forth. Different from the circular friction massage, and I'm not moving on the surface, I'm staying on the tissue and I'm moving those fibers back and forth to help the fibers that have just laid down randomly let loose and realign in the order that I want it to realign. Okay? So again, we can do techniques here to the muscle and to the tendon. But let's turn the arm over and let's talk about maybe doing some techniques for carpal tunnel down here at the wrist. Okay? Carpal tunnel is entrapment of this nerve here at the retinaculum at the wrist, and it causes pain and weakness down here in the thumb. So we can do thenar circles, good old kneading, or we can do techniques here on the wrist. But the new one that I want to show you is called separation. And in separation, you're just doing that. You're separating two bones, two surfaces. This is your thenar eminence. This is your hypothenar eminence. So in separation, I'm just going to balance and give a little counter pressure on the back of the hand. Get on these bones here of the thumb and the pinky finger and pull apart, kind of a round pressure out, and just hold. Thenar, hypothenar separation. So we're getting a little stretch on that area that's tight. Hold for a few seconds and release. We do the same thing up here where the actual entrapment is. This is your radius on the thumb side, your ulna on this side with your little styloid processes here. So counter pressure on the back of the wrist and separate. Okay, so anytime you're wanting to separate, to stretch, to give pressure relief, we talked about it on the bottom of the foot with plantar fasciitis, you can use a separation technique. Okay? And again, lots of techniques you could do here on the arm that we've already covered. They would just be for that body type. But we're going to readjust one more time and show you one more technique that's for edema reduction, whether it's the arm or the leg. We're now set up as if he had arm swelling, arm edema. The arm is higher than his heart and supported, but where I can get to it, we can push his sleeve up so I can go all the way up to the shoulder if need be, if this were a lymphedema kind of problem, and it's not binding here, and I could put some draping on that if need to. For edema, you do want gravity to help you. Your strokes are very slow, and it typically takes longer to do a massage. How far you need to go will be dependent on whether it's venous or lymphatic. You probably are not going to have swelling in the palm of the hand or the bottom of the foot if this were a foot. And you always want to start distally with your techniques and work proximally. Okay? So you're going to start down here in the fingers. And you're wanting to try to, of course he doesn't have swelling, but you want to try to push that fluid out of each finger. So I'm doing kind of a rotatory twist as we start what's called milking, as we milk the fluid. So I just hold, I can stabilize here at the knuckle, and I press. And I do that for each finger to get the fluid starting. And the thumb. And then we go to the dorsum of the hand, and you can do various techniques to get that movement started of fluid. So we can do some kneading. We could do some point hacking. Anything like that to get the fluid started. Then we're going to do long, slow strokes of milking to move that fluid. You're envisioning all of the fluid going up towards the shoulder where the body can handle it. We'll then move up to the lower arm area. Do techniques first to mobilize the fluid. So you could do picking up, you could do ringing, you could do any of your percussions. Then, once you do that, then you're going to try to slowly milk. And I'm doing kind of a C grip as I stabilize with the other hand. And stabilize and C grip. And once you do that body area, you're going to come back and milk again to make sure you haven't pushed any fluid down distally. Fingers, dorsum of the hand, milk on up. Now I'm going about 3 times as fast as you should. But then if I'm needing to go on up to the shoulder, then I'm going to do some of the same techniques up here on the upper arm to loosen them up, milk that area, come back and milk again. So with every one, we come back distally and we milk with these long, slow, kind of this rounded kind of position of my hand to push the swelling. Deeper pressure if it was venous, much lighter if it's lymphatic, farther for lymphatic, regardless of where the swelling is, because we have to go all the way to the proximal joint, just to the next joint if this was venous. Okay, so that's a brief introduction to milking. I think that finishes our massage strokes, if I can say that word. Hope this helps.